Being on the water kayaking gives me a greater sense of freedom, more so than any other sport that I participate in. My name is Ryan Christian Major. I'm retired Staff Sergeant out of the United States Army. I do kayaking to first keep my time filled and with activities. I've always loved the water. I had some experience prior to my injury, whitewater rafting, and I just wanted to try something new, and kayaking was the next thing. So other thing I like about kayaking is interacting with other people, fellow kayakers, and just being out on the water.
So what people are beginning to understand better and better about traumatic injury is that it's not just treating the physical injury, but it's also treating what happens to an individual psychologically and socially. I'm Ellen MacKenzie, and I am professor and chair of the Department of Health Policy and Management in the School of Public Health. And I've been doing this kind of work in injury outcomes for about 30 years. What really surprised us about our early work is that if you looked at the people who had been injured in a motor vehicle crash, and you looked at the folks who didn't have a major brain injury or a major spinal cord injury, which we know can result in significant disability, but you look at people who had fractures to their legs or to their arms, that they still had a difficult time recovering. And it's not just the physical injury, but it's all the mental health consequences of being in a traumatic injury that made the difference. So the surgeons say, well, what can we do about that? We've done the best we can in terms of reconstructing the limb, putting the limb back together, but we can't teach people how to be more self-confident. But in fact, you can change someone's self-confidence, and that's what we learned from the rehabilitation psychologists like Steve Wegener. And there are programs that do exactly that. They build one's confidence, they teach them skills. They teach them skills about how to talk to their providers, how to manage their pain, how to advocate for themselves, and they become empowered.
I don't think people realize the hard work that goes into the rehabilitation, getting back to where I was before my injury. People see me now and they don't think anything serious has happened to me versus the obvious. Other than my physical injuries, a large part is mental. It's taken me a long time to get where I am right now today. Lots of speech therapy, lots of meetings with my psychologist to get over my physical injuries and help with my mental, and I've come a long way.